Today we are going to talk about a very serious subject: cancer. The word itself strikes fear into the hearts of many. While advancements in detection and treatment have dramatically improved survival rates, the insidious nature of cancer means some signs can be easily overlooked even by medical professionals. This isn't a cause for alarm, but rather a call for greater awareness and proactive communication between patients and their doctors. This conversation aims to shed light on those subtle, sometimes seemingly unrelated symptoms that might signal something more serious. Let's be clear, this isn't a self-diagnosis guide. If you're concerned about your health, always consult a doctor. This information is designed to empower you to have a more informed conversation with your healthcare provider, ensuring no stone is left unturned in the pursuit of your well-being. 1. The fatigue factor, more than just tiredness. Persistent, overwhelming fatigue that doesn't improve with rest is a significant warning sign. It's not the typical tiredness from a busy day, it's a debilitating exhaustion affecting even simple tasks. While numerous conditions cause fatigue, anemia, thyroid issues, depression, infections, it's crucial to discuss persistent fatigue with your doctor, especially if accompanied by other unusual symptoms. Cancers associated with fatigue: leukemia, lymphoma, colon cancer, multiple myeloma, lung cancer. The fatigue stems from the body's battle against cancer cells, affecting energy production and immune function. What else is it? Anemia, low red blood cell count, hypothyroidism, underactive thyroid, chronic fatigue syndrome, depression, sleep apnea, various infections, kidney disease, heart failure. Diagnostic tests: complete blood count, CBC, blood chemistry panel, checking organ function, thyroid function tests, imaging studies, CT scans, MRIs, PET scans depending on suspected areas, bone marrow biopsy for leukemia and lymphoma, sleep studies. 2. Persistent pain beyond the ache. Chronic pain, especially in areas unrelated to injury or known medical conditions, requires investigation. Bone pain, persistent headaches, and abdominal pain, unresponsive to usual treatments, may signal underlying issues. Cancers associated with pain: bone cancer, osteosarcoma, Ewing sarcoma, brain tumors, gliomas, meningiomas, pancreatic cancer, ovarian cancer, prostate cancer, bone metastasis. Pain arises from tumor growth, nerve compression, or bone metastasis. What else is it? Arthritis, fibromyalgia, migraines, musculoskeletal injuries, endometriosis, irritable bowel syndrome, IBS, kidney stones, nerve compression. Diagnostic tests: X-rays, CT scans, MRIs, bone scans, biopsies to obtain tissue samples for microscopic examination, blood tests to look for markers associated with certain cancers. 3. Unexplained weight changes, significant fluctuations. Significant and unexplained weight loss or gain is alarming. While lifestyle changes usually account for weight fluctuations, a rapid and substantial weight change, especially weight loss without intentional dieting, warrants immediate medical attention. Cancers associated with weight loss: stomach cancer, pancreatic cancer, esophageal cancer, lung cancer. Weight loss occurs due to impaired nutrient absorption, increased metabolic rate, or loss of appetite caused by the cancer. Cancers associated with weight gain: certain types of breast cancer and other cancers affecting hormone production may lead to weight gain due to hormonal imbalances or fluid retention. What else is it? Hyperthyroidism, overactive thyroid, diabetes, digestive disorders, celiac disease, Crohn's disease, infections, psychological factors, depression, anxiety. Diagnostic tests: blood tests checking for metabolic abnormalities, hormone levels, imaging studies, CT scans, MRIs, endoscopy, biopsies. 4. Changes in bowel or bladder habits, heeding the signals: persistent constipation, diarrhea, changes in urinary frequency or urgency, or blood in stool, urine demand prompt medical attention. Even seemingly minor persistent changes warrant a doctor's visit. Cancers associated with bowel bladder changes: colon cancer, rectal cancer, bladder cancer, prostate cancer. Changes result from tumor obstruction, inflammation, or irritation. What else is it? Irritable bowel syndrome, IBS, infections, urinary tract infections, gastrointestinal infections, hemorrhoids, diverticulitis, inflammatory bowel disease, IBD. Diagnostic tests: colonoscopy, sigmoidoscopy, cystoscopy, urine tests, including cytology, prostate-specific antigen, PSA test for prostate cancer. 5. Skin changes beyond a simple rash: persistent sores that don't heal, new moles or changes in existing moles, size, shape, color, asymmetry, borders, the ABCDEs of melanoma, unexplained itching or jaundice require prompt dermatological examination. Cancers associated with skin changes: melanoma, most dangerous skin cancer, basal cell carcinoma, squamous cell carcinoma, other cancers metastasizing to the skin. Skin changes can be a primary manifestation or a sign of metastasis. What else is it? Eczema, psoriasis, infections, fungal, bacterial, benign skin lesions, moles, warts. Diagnostic tests: skin biopsy to examine skin tissue under a microscope, dermatoscopy, a non-invasive technique using magnification to examine moles, imaging studies if metastasis is suspected. 6. Persistent cough or hoarseness, more than a cold. A persistent cough lasting weeks, especially with blood or mucus, or unexplained hoarseness or voice changes, needs attention. Cancers associated with cough hoarseness: lung cancer, throat cancer, laryngeal cancer, esophageal cancer. Symptoms result from irritation or obstruction of airways. What else is it? Bronchitis, pneumonia, asthma, allergies, gastroesophageal reflux disease, GERD, vocal cord nodules. Diagnostic tests: chest X-ray, CT scan, bronchoscopy, a procedure to examine the airways, biopsy. 7. Swollen lymph nodes, more than a bump. Persistent swelling of lymph nodes, glands part of the immune system, particularly if hard or painless, warrants investigation. Cancers associated with swollen lymph nodes: lymphoma, Hodgkin's and non-Hodgkin's, leukemia, cancers spreading to lymph nodes. Swelling results from cancer cells accumulating in the lymph nodes. What else is it? Infections, bacterial, viral, autoimmune diseases. Diagnostic tests: physical examination, blood tests, lymph node biopsy to examine the lymph node tissue. 8. Unusual bleeding or bruising when it's not just a bump. Unexplained bleeding, nosebleeds, bleeding gums, rectal bleeding, vaginal bleeding, or easy bruising requires evaluation. Cancers associated with bleeding, bruising, leukemia, lymphoma, other cancers affecting blood clotting factors. This occurs due to impaired blood cell production or clotting function. What else is it? Vitamin K deficiency, platelet disorders, liver disease, medication side effects. Diagnostic tests: complete blood count, CBC, coagulation studies to assess blood clotting, bone marrow biopsy for leukemia, lymphoma. 9. Persistent digestive issues, more than indigestion. Persistent indigestion, heartburn, nausea, vomiting, or loss of appetite, especially if new or significantly worse, may indicate cancer. Cancers associated with digestive issues: pancreatic cancer, stomach cancer, esophageal cancer, colon cancer. Symptoms arise from tumor growth, obstruction, or inflammation. What else is it? Gastroesophageal reflux disease, GERD, peptic ulcers, gastritis, irritable bowel syndrome, IBS, food poisoning. Diagnostic tests, endoscopy, a procedure to visualize the digestive tract, imaging studies, CT scans, MRIs, biopsies. 10. Neurological changes, beyond the usual. Changes in neurological function, numbness, tingling, weakness, seizures, changes in vision, cognitive impairment, require immediate medical attention. Cancers associated with neurological changes, brain tumors, cancers metastasizing to the brain. Symptoms result from tumor compression on nerves or brain tissue. What else is it? Stroke, multiple sclerosis, other neurological disorders, diagnostic tests, neurological examination, MRI scan, CT scan, EEG electroencephalogram, lumbar puncture. Beyond the obvious, unmasking hidden cancer clues. We often associate cancer with dramatic symptoms like noticeable lumps, severe pain, or dramatic weight loss. But many cancers, especially in their early stages, are masters of disguise. They manifest as subtle, often vague symptoms that can easily be attributed to other, more common ailments. This is where the real challenge lies. Why doctors might miss subtle signs. It's important to understand that while doctors are highly trained professionals, even they can miss subtle cancer signs. Several factors contribute to this. Vague symptoms. Many early cancer symptoms mimic those of common illnesses, making diagnosis challenging. Lack of specific tests. Some cancers don't have readily available or reliable screening tests at early stages. Individual variations. Symptoms can vary significantly between individuals, making it harder to establish a pattern. Time constraints. Doctors often have limited time with each patient, which can affect the depth of investigation. Patient reluctance. Patients might hesitate to report symptoms, downplaying their significance. Empowering yourself. Proactive communication is key. The key to early cancer detection is proactive communication between you and your doctor. Don't hesitate to keep detailed records. Note down the onset, duration, and severity of your symptoms. Be persistent. If your symptoms aren't adequately addressed, seek a second opinion. Ask questions. Don't be afraid to inquire about potential cancer-related causes for your symptoms. Advocate for yourself. You are your own best advocate. Push for thorough investigation if you have concerns. Maintain a healthy lifestyle. Regular exercise, a balanced diet, and avoiding tobacco are crucial preventative measures. While this discussion explores potential cancer signs that might be missed, it's crucial to remember that many people experience these symptoms without having cancer. This information serves to empower you to have open and honest conversations with your healthcare provider, encouraging a thorough investigation whenever necessary. Early detection significantly improves treatment outcomes, making informed communication the most powerful weapon in the fight against cancer. Remember, your health is your responsibility. Don't hesitate to seek medical attention if you're concerned, and advocate for yourself. Your life depends on it. Thank you for watching. See you again soon.